Critical response to South Africa's growing youth mental health crisis, the non-profit organisation Heal SA is launching a dedicated and comprehensive fight to champion mental wellness among young people. Recognising the profound impact of issues like depression, anxiety, trauma and socio-economic pressures on the nation's youth, the organisation is positioning itself at the forefront of advocacy, awareness and accessible support. Let's chat now with Heal SA CEO Mpadi Makgalo. Mpadi, appreciate your time this afternoon. Now, the statistics are staggering from your frontline perspective at Heal SA. What does a silent epidemic of youth mental illness actually look and feel like on the ground?
Oh my goodness. Thank you so much for having me, Hugo. The situation on the ground is very dire. We work with young people both in universities and in high schools and unemployed youth. And we see through our helpline, increasing numbers of suicide ideation, increasing number of depression and anxiety, and hopelessness in general. And we have healthcare systems that are not equipped to support young people, unfortunately. And we're saying, enough is enough. Mental health, especially youth mental health, can no longer be an afterthought. And with this campaign, with this fundraiser, we're saying we no longer want to be that reactive organization where we get called in when a child has committed suicide or when there is a crisis, to say we need to be more proactive. And with the little funds, and which we really do appreciate from our funders, it is not enough for us to be able to support our young people as we should.
Now, why are young South Africans particularly vulnerable to this crisis? I mean, what are the unique pressures they face that perhaps previous generations did not?
I think for me, first thing first, it's, for those young people who have graduated, struggling to obtain employment. We just heard from our government not too long ago that unemployment rates are at a staggering 62%. But also, I think in schools, we see a lot of the country that we live in, there's just general trauma. And the trauma now is translated into the education system where young people can't regulate their emotion. Young people can't absorb the education because you are so traumatized at home and you're now expected to sit for 5 to 6 hours and learn a new concept and a new lesson. And there's just a lot of anger that we see with young people because not having safe space to be able to express themselves. And that's where we have Heal SA and our attempts in trying to say we're here to listen, and we have professional psychologists and social workers that are very privy to who you are as an African child.
Now your organization is called Heal SA, and in that name almost suggests that there is a broken individual that you are looking to repair. Is this a correct assessment of Heal SA and maybe also an indication of the work that you then have to do in this healing process?
Yeah, Hugo, our communities are bleeding, and I think we are bleeding as a nation. I think to look at us as a community in isolation would be very short-sighted. But I think the social ills that we see in the community, they do have a mental health ramification, and that's where we sit to say we can't be subjected to so much violence and subjected to so much instability as a country and accept our young people to somehow be normal, that it does affect their mental health. And we cannot longer sit on the sideline and say this somehow will work itself out. And unfortunately, our young people are no longer confronted with the same pressures that we were confronted with when we were in university. I mean, when I went to university, there was no social media. I didn't have a cell phone, and the challenges that I was facing then and the challenges that a young person is facing now are two different. It's two different worlds that we're talking to.
So how does a parent or a guardian build resilience in their young daughter or young son? Because that's a big part of it, right? Because you talk about pressures, that these young people have to deal with, and parents or families may not have the solutions, right, to take away the pressures outside of teaching or training or equipping these young people with a skill set to manage the pressures.
Yeah, and I think for me, Hugo, what you are now touching on is our whole concept of healing. We don't believe in healing in isolation. I think for me, our counseling is rooted on Ubuntu to say, right now we are dealing with a lot of stigma. And when we talk about resilience, you have to have parents who are open enough to not have bought into the idea of stigma, to say, when my child is now saying, mom, I can't cope with school, I can't cope with being bullied at home. They no longer, like, they don't see it as a weakness on their child. They don't see it as something is wrong with my child. And to be able to say, how do we work this part together? And there is no one size fits all as it comes to mental health. I think children are different, and in different points they need different things, and it's for us as parents to be able to be privy to that. And I always argue at times to say we are putting so much pressure on parents who also do not have the skills and even the know-how to say, how do I navigate my own emotions, let alone support my child to be able to navigate their own emotion. And that's why we all at Heal SA we see healing as a collective act. It might start with therapy, but as you go and we talk to you, we realize actually we need to talk to your parents. It's not for you to be supported with whatever it is that you're going through.
Mpadi, you walked us through, well, very briefly, your journey when you were in university, and the fact that you didn't have a cell phone, so pressures were different. But now that there are cell phones, there's also technology, which has grown in leaps and bounds over the years. And teletherapy, I think, is something that you use. Just walk us through the value of technology in bridging the gap and reaching out to some of these young people.
I think for me, it has been a game changer. And I mean, we work with university that would ascertain that they do have these services, but unfortunately they do not work late hours. But also it's the privacy. I think the ability to be able to be in your bed and you are WhatsApping us and you're talking to a qualified therapist who's culturally aware of what it is to be a young person from Limpopo, and now you are in the middle of vets, and it's like big city. So that cultural relevance is also very important in terms of our young people getting services from us. But I think technology has actually, I mean, we're getting more. We're giving more support through WhatsApp than we are doing through Helpline. But I think it's just the confidentiality of being able to do that, and the servicing them being for free, to say, I don't, I'm giving 45 minutes to an hour a week where I can talk to a professional therapist that can help me navigate without stigma. I think, and I think technology also addresses issues of stigma, because when I'm on the call by myself, you could assume that I'm on TikTok. You could assume that I'm just WhatsApping another friend somewhere, but I'm actually getting help. So that has been a game changer in ensuring accessibility, but also addressing stigma, because we know that young people are scared to walk into the therapist offices where somebody can now see that, oh, okay, or you have a problem or whatever. So the confidentiality and stigma are addressed through technology.
So what skills has your team had to develop over time in order to deal with an individual via WhatsApp? Because if I'm having a conversation with you via Teams or Zoom and you can see me, or you're my therapist and I'm sitting across from you, right? There's a lot of body language, there's a lot of emotion that I can read into. So many of these things you physically don't see when you're on WhatsApp.
Yes. And I think for us, I mean, we always say the first 2 sessions are just an intake. It's for the therapist and the client to have a rapport and be comfortable. But also, Hugo, you'll be so amazed at how, your AI and our kids are on the phones and they have a different relations to these gadgets that you and I have. I mean, I stop a conversation when I see see that it's becoming serious, because I'm like, no, I need to talk. Where else they are more comfortable not seeing you, because that's how they've been, their orientation to media or to communication has been through these gadgets. So for them, it's actually their go-to. For us to upgrade somebody to a call, it would take at least maybe 6, and you could see 6 sessions. That is, you could see most young people are actually not even comfortable looking at you. I think they're being anonymous in a way gives them latitude to be able to express themselves fully. It's something that they're very comfortable with, and it works for them.
Now, as we wrap the conversation, you've reached, I think, close on 8,000 clients. Is there a story of a young person you've helped that particularly sticks with you and reminds you why this work that you do is so incredibly important?
Oh my goodness! Oh, definitely. We had helped a young person, and actually we have a video of it. A young person who was raped as a young woman, who was raped as a child, and in her in teenage, the memories started coming, and she started looking for support at clinics, and she got frustrated with the waiting and started self-harming. And then she went back for self-harming, and she was actually reprimanded for that instead of, cared for. And she somehow got our numbers and got counseling through us. And she's now speaking about how that was a game changer for her, and how that healed her, and how that actually, helped her start healing her childhood traumas and abuse and so forth. And so I think for me, that's one story that even when I'm down and low, and you're like, oh my goodness. And when you remember, her name is Bunolo. When you remember Bunolo's story, you're like, wow. It is worth it. It is worth it.
Mpadi, we certainly appreciate the incredible work that you're doing. So how do these young people find you? How do they reach you? Where do they go to get some of this assistance that we're talking about?
Okay, for a helpline, they can call us on 010-880-3334. And for our WhatsApp line, they can WhatsApp us on 066-323-6869. And for these for the fundraising campaign, we've partnered with Mpadi. So it's Mpadi at .co.za, and you can just type youth mental health reimagined, and you'll get our donation line.
Mpadi, absolutely great speaking to you. Appreciate your time. Mpadi Makgalo, public health specialist and CEO of Heal SA. Incredible work that they're doing to support young people across the country.